Hello and welcome to the Health ICT portal tutorial session on virtual health community. The first thing to say is that you should be logged in to access the content that the health community provides. The health community itself is basically a multimedia document content repository broken down by departments inside various entities. So the three entities that we have on here at the moment are the acute secondary care hospital, primary care in the form of a general practitioner, and enterprise administration. So these are for enterprise-wide, whether that's at a hospital, a health authority level, or a national level. All enterprise IT functions are detailed in here. To access the content, simply click on the department that you're interested in, and so in this case we'll take medical imaging. And the first thing that you'll see here on the left-hand side is the major categories that are available for the medical imaging department. So we have software, services, standards, best practice, thought leadership, hardware, education, and medical devices. If I click into the software department, then you'll see that all of the content for the software appears down the right-hand side here in this main pane. So in the software department, we've got a total of 6 documents in total. To open the document content, simply click on the file that you're interested in. So I'll just take the test software PDF, and that will open up through your standard browser technology. And I'm just going to click on that, open up the PDF. It's just downloaded, and the PDF file just appearing through the Adobe Reader. I think it's important to note that all of the content that's provided in a repository is you require your own reader to access. So whether that's PDF, if it's PowerPoint, you'll need something to view PowerPoints, and likewise with Word documents, Excel, etc., etc. Other information that you'll see on here, apart from the précis, which is the author's own description of the content, you will see the author themselves, and you also have the ability to view comments and to leave feedback and to rank the document as well. So let's just flip into that. I'm going to go into the view comments section, and here I have the ability to say let's rank the document. Nice example of a PDF, and I'm going to leave that comment. The thing that you'll notice here is that comments will only be published once they've been approved by the content supplier. So basically this generates an email, sends it off to the content provider, and then they can upload those comments on your behalf. So I've done that, and I'm just going to step back into the community here. I can also contact the author of that content directly by clicking on the author tab there, and here I get to see the information about the provider's profile, any information about a website. If they've left a telephone number, you can contact them by telephone, but if they haven't, you can at least contact them by email. So click on the contact user button, you can send them a message here. So I've got something called test message, liked PDF content, please publish my comments. Okay. Important thing to note here is that the email that it comes from is the email that you have registered on your profile. So it's not a healthictportal.com address as mine is. It'll be your own registered email address. Okay. So I'm just going to send that email. The email was sent successfully. I'm just going to step back into the community now. Now, it may be that there's lots and lots of documents here, so you perhaps need to use the filters on the left-hand side to break the information down even more. So if I was to click on packs, for example, you'll see that my list just comes down to 2 documents. Other things to note here, we have all of these flags at the bottom, and the number beneath each of these flags represents the content stored for that country. Now, at the moment, there's only something in there for Great Britain, but you can see that if we flipped across to the United States, if there was document content in there, you'd be able to see all of their content as well. So it's a good way of being able to see how practices differ and look for ideas from other countries. Okay. So that's basically how it works for every department. All of the departments have these main categories. Each department has a number of subcategories, and you can navigate to content that way. Also, you'll see on here that we have a View Medical Imaging forum and a tester link. So these basically have the ability to put hyperlinks to useful information, and we'll look at that a bit later on. And I'll come back to the forums a bit later on as well. Now, there is another way of navigating the virtual health community, and that's through perhaps a more physical-looking screen on the right-hand side. So if I didn't necessarily know I wanted to look for software packs, then maybe I should go into the CT department, and I could see the various categories that were available just by rolling my mouse over the picture. So you'll see on this particular picture that I've got links out to a reporting department. All departments are signed, posted in blue. We've got personal health records by highlighting over the patient, CT scanners by highlighting the machine, PACS if I highlight over the PACS viewer, and radiology information systems. I think there's also something over the clinician, which is best practice. So I'm going to click PACS here, and what you should see is it takes me back to the same view that I had by navigating through software packs. So simply put, the diagrams that you see here are shortcuts to other information that's on the left-hand side in these main categories. But the idea is that here that you can follow a flow and perhaps see things that didn't you jog your memory. So, for example, you're kitting out a radiology department. If you followed the links through to reading, you think, oh, well, maybe I can do something with digital dictation, for example. Okay, so that in a nutshell is how the main site works. Just a couple of other add-ons I'm going to show you. If I click into here I can see View CT Forum. I think I mentioned forums before. I'm going to click into that, and it's going to open up my forums window. I'm just going to scroll down so that you can see everything I've got here, and basically this takes me through to the forums where I can go in and have a navigate through and play like a regular forum. So not only can I see information that's in the document repository, but I can talk about it and exchange ideas about it with colleagues as well. So I think that wraps up this presentation for today. Hopefully you found it useful. Feel free to leave me a comment through the main categories on the forum site. So if you've got any ideas, then go into the suggestion box and drop some comments. Otherwise, I hope you enjoy using the site and look forward to hearing from you soon. Thank you.